to die. Patient who is already having chronic renal failure on ventilator, and you do CPR, then you say CPR has not given results. This is not done. CPR is only and only where death is unexpected, unnatural. CPR role starts only in those patients. Now, what are the situations where death is unexpected, unnatural? Somebody sitting here, somebody sitting at home, suddenly become unconscious. CPR is only for that population. And he will give you some basics, and I will add some scientific things also. What is primary, what is secondary. So CPR is only the concept where death is unexpected, sudden. And God gives you only what you are looking for. What does this statement mean? If before starting CPR, you say patient has to die, how patient can survive? Give me a reason for that. You cannot survive. Patient cannot survive. Because you already decided in your mind this patient is going to die. So please do not decide anything negative in life. God gives you what you are looking for. Beware of your dreams. Dreams come true. What you imagine in your life, you get it. You have already paved the way for this. This is called as infection. I don't know people who have read these many books. This is science of pressure, vibrations. What you give, you get back. Now, patient suddenly becoming unconscious, sitting and eating meals or in a party, that is CPR. And how does it happen? Let's start. Dr. Swinder, please. Dr. Swinder is colleague with me. He is basically a sonologist. He has been practicing sonology for the last couple of years with his own clinical practice in Himachal Pradesh. Now he has joined me full time as an assistant with me. Dr. Swinder, please.
Good evening, friends. It's my privilege to be with you on this beautiful evening. So there are some misconceptions about CPR. Today we are going to tell you the right way of CPR, and this way you can save someone's life and some family. So in our routine practice, sometimes we encounter such patients, sometimes we encounter such type of patients in our home or nearby. So what happens? When a patient fell down like this, most of the time what happens, people try to give some water in his mouth. Never do that. First of all, never do that and just take the mouth. And secondly, you need to do, just uplift his or her legs so that the poor blood can come to the heart bed. That will fill the heart. And immediately you can do one thing. Just do like this. This will happen to fall back the tongue from the trachea and the airway will be patent. So most of the time, the 40% of the cases approximate, it can help you to revive the patient.
See, basically, once patient becomes unconscious, there are two types of cardiac arrest. One is primary, second is secondary. Secondary cardiac arrest is patient is drowned. He gets cardiac arrest because he has consumed all of his oxygen. And arrest is secondary to hypoxia. That's what primary cardiac arrest. So we don't treat primary cardiac arrest CPR the different way. I will tell you also. What I know is primary cardiac arrest. Primary cardiac arrest basically means suddenly heart stops. That is primary cardiac arrest. Now once patient becomes unconscious, first see the patient has cardiac arrest. Don't start massage anything until you are sure patient got cardiac arrest. Patient suddenly becoming unconscious. Suddenly becoming unconscious has to be cardiac arrest unless proved otherwise. Reason being, no epilepsy, no hypoglycemia, no other disease will make him suddenly unconscious except intracranial hemorrhage because of aneurysm. In that situation, he will not stop breathing. He will continue breathing. His heart will not stop. So what I am trying to say is, any patient becoming suddenly unconscious, first make it sure that he is not breathing and his pulse is not there. When you want to palpate pulse, do not palpate a radial artery, palpate a carotid. My only request is, this is not theory, sir. This is all practical, all practical. We must do. Knowledge is not knowing the thing. Knowledge is applying in a situation what you know. That is knowledge. So once you have examined the pulses, examine carotid, examine forehead, takes only fraction of a second to know the pulses. Slap on the patient face. Is he normal or not? If he is not breathing, the rest is there. not. If patient is not breathing, we always run for the airway ambu bag. It is ridiculous because every body can survive for 5 minutes by holding his breath. What does it mean? It means that in a patient who gets cardiac arrest, we do not need oxygen. We do not need intubation. We do not need ambu bag. We are scared to do intubation, to start doing intubation, to don't do what is required. Why? Because once heart has stopped, lungs have sufficient oxygen kept in the lungs for 5 minutes, where oxygen is not required. So do not run for the oxygen. Do not run for the ambu bag. Do not run for the intubation. Everybody doesn't know intubation. What you know, you must apply that. So first is, airway is important, ventilation is not important. I tell you why. Ventilation is important. Ventilation is not important. Airway is important. Now what he was trying to say is, one thing is unconscious, it might be vasovagal, will hypoxemia also, but that doesn't happen suddenly. That's always gradual. Vasovagal also, it will start feeling something giddiness, some nausea, some vomiting, some sensation of abdomen, and it falls gradually. That is vasovagal. Hypoxemia similarly. So in that situation, raise the legs. It means basically what I'm trying to say is, spoke as vasovagal, don't try to make the sick patient, don't try to sit the patient. You will have again brain hypoxia because blood will come down again. Raise his legs so that blood comes to the heart. This is one step we are telling about vasovagal, not as a cardiac arrest. Second is when patient comes unconscious, tongue falls back. Like when tongue falls back, it stops breathing. It's the way it happens. So you do gargles. When you do gargles, what do you do? Put the tongue back. Lift the chin. So once you lift the chin, tongue automatically comes forward. The second point he was telling. Second point is, lift the chin, it will automatically make tongue come forward. It will automatically open. If at all something is out, take it down. No need of mouth aspiration at all, even at home. Forget hospital. You don't need anything for 5 minutes for ventilation. These are 2 points here. Third point, continue.
So then we need, in such situation, then we need to start CPR immediately. And how we start CPR? First of all, you need to understand the right technique. Your both the arms make a grip like this. This is called the heel of the hand. And whatever is convenient, right or left hand according to you, you can do that. Put forward and keep your both the arms straight. Your shoulders must be straight, and put these heel of the hand on sternum in the middle of the chest, not on the precordium area, not on the heart area, in the middle of the chest on sternal area, and give a full pressure with whole of your body. Force. Your pressure should make the chest down approximately 2 inches. Like straight, not this way, this way. Go, press, leave, press, leave. When you press, blood will go out. When you leave, blood will refill the heart. So that way you will be able to send the blood to your brain and you can avoid brain hypoxia. So keep on doing this, and you can count it or do not count it. If you do it around 120 times, so that is sufficient to revive a patient.
This is called as cerebrocardiac resuscitation. This is not pulmonary resuscitation now. This is cerebral resuscitation with cardiac resuscitation. What is the aim? Aim is that blood must go to brain. So cerebrocardiac resuscitation. How does it happen? Suppose you do cardiac massage, and tell you what to do. Suppose you do cardiac massage, you're pumping blood out of the heart. And lungs have the oxygen already. It goes to brain, patient doesn't become unconscious, doesn't become brain dead. Now how to do cardiac massage? First is at what place, second is how to do, third how many times, fourth how much pressure has to be applied for. Let's see the place first. Do not, if somebody says that I have broken the neck for a cardiac massage, we do not be stupid. He doesn't know how to do cardiac massage. Who don't do cardiac massage pre-cardiac, there is no way you will break the ribs. Because we do cardiac massage at lower end of sternum. You don't do cardiac massage at precordium, sir. So how can you break the ribs at precordium? You can break the ribs only if you do massage at the precordium. Take your finger from this notch, come down to the lower end of sternum as you did. This place is lower end of sternum, not at precardial. This is what we told. One. Second point is, how do you do massage? Massage is done with your hands, heel of hands. Make a fist of it. Keep your hands absolutely straight. You cannot do massage like this. You don't put sufficient force. You cannot do massage like this. You have to do massage perpendicular. Your shoulder has to come perpendicular. Yes, sir, but I always feel is that science has taken so many years, so many lives have been lost just to understand this thing that massage is not for the wrist. Massage is not for the elbow. This is not a small point. How much life must have been lost to understand this is the point. So always do massage from the shoulder. It has to come up and down. Why do we keep our knees on the bed? So that our shoulder becomes straight. Its force is transmitted straight down. So number one is place. Number two, with either hand. Number three, how do you do it? Number four, how many times you do? No need to count. Dictum is as fast, as deep as possible. Faster, deeper. That's it. This is very understanding. It means you need not count even. If a normal person does the massage, he will be tired after 110 per minute. It means if you don't count it, it is going to be 100 or 120. So no need to count at all. Third thing is how much pressure to apply. A normal person, not a bodybuilder, you apply pressure maximum. You cannot apply more than 2. You need not know 2 inches, 3 inches. It automatically comes to a point when you apply pressure maximum, it comes to that point only. Point is when you give massage, please leave the heart also. Don't take the hands off. Take the hands there only, but release it so that blood starts flowing back and flowing in and flowing out. So deeper, faster, 2.2 inches, heel of the hand, lower of the sternum, and do not do any oscillation. Now I come to one point. Everybody has seen defibrillator at the airport and even in India, airport and flights, and I'm surprised and shocked and being miserable that we as doctors have nursing homes without defibrillators. Imagine that. We have defibrillated the roads, on the aeroplanes, at the all malls where patients can give shock. And we in India, we as doctors in developing countries have nursing home full flash without even having defibrillator at the hospital. You cannot be cardiac, this was the cardiac massage occurring outside the hospital. Once it's in the hospital, treatment is only one, that is DC shock. Don't look at any monitor. Don't look at any damn thing. Patient unconscious, most of the time it is beating. 90% of patient become cardiac arrest. It is ventricular tachycardia, and that is treatable. So treatment is only DC shock. If you don't get DC shock, you can do massage and you can give one thumb. That sometimes can revert BT to normal rhythm also. Second point is when you do DC shock and massage, please you keep the paddles at the chest only after charging it. Don't keep it in charge. That is wasting time. You cannot stop massage even for looking at the monitor. You continue massage. So even after DC shock, do not look at the monitor otherwise come back and not. I tell you why. Because there is an electromechanical delay. If you take DC shock, the mind come back to normal, but pulse will not come back. It takes some time. So don't do massage till patient regains consciousness. So defibrillator has to be there. Don't look at the monitor. Don't charge by giving defibrillator on the chest. First charge it and then keep it in the chest. And by the time somebody is charging, please do not stop massage. So much so, we do not stop massage for any respiration these days. No respiration to be given. Suppose now, I tell you respiration also. Suppose patient has drowned. Drowning is there. There is a fire. In fire and drowning, he has consumed oxygen already of the lungs and then cardiac arrest happens. So in that situation, a mouth respiration is important. So in that situation, intubation is important. It has been said that do not do MPBI more than 6 times a minute. 6 times. In hurry, in stress, you go doing it. More number of times you do, cardiac output comes down. Blood will not go to coronary, blood will not go to brain. So only 6 times is sufficient. Even if you are intubated it, 6 is minimum, 8 is maximum. You cannot do more than that. Because every time you give Ampubag, there is a positive pressure in the lungs that drops down. The difference between it is normally we breathe negatively. Lungs sucks air. Whereas Ampubag, we pump air to the lungs. That is reverse. That is why we don't do Ampubag more than 6 to 8 minutes. So first is recognize it is happening. Second is understand where you are. Are you from the hospital or in the private place or outside? In outside, massage. In the hospital, DC shock massage. Soda bicarbonate has no role. Calcium has no role. That is only when patient is already 10 minutes of massage, he gets acidosis. Once you need soda bicarbonate, patient is going to die. Because you get sufficient acidosis, hypoxia, already patient is going to die. So don't need a soda bicarbonate. Treatment is only adrenaline, massage, DC shock. These three things plus minus cortisone, that is not important. Important is epinephrine, massage, and DC shock. With these words, we are open for discussion.